So while the presentation's coming up, I'll just say a few thank yous about this report. The report actually was done by End Youth Homelessness Cymru, and actually, really importantly, the actual research was carried out by peer researchers, so young people who are LGBTQ plus themselves, who were trained by Shelter Cymru, by Edith England and by Rebecca Jackson, so thank you very much to them. And thank you also to Hugh Russell and his End Youth Homelessness Cymru colleagues as well for really getting this report off the ground, and to End Youth Homelessness Cymru's LGBTQ plus steering group chaired by Andrew White from Stonewall Cymru, who really helped edit the report and really pushed for this report to happen. So I'm going to take you through some of the findings of the report and some of the recommendations as well. And you'll see as I go through the slides that there'll be some quotes coming up from some of the young people about their experiences of being homeless and being LGBTQ+, and hopefully you'll be as shocked as I am to read some of their stories. I'm pressing it the right way, that's good. Okay, so I'm just going to talk a little bit about the prevalence of LGBTQ+, or youth homelessness. We know that this work tells a lot about young people and what they experience. And we know, and we found out from this work, that LGBTQ plus young people are disproportionately overrepresented in the homeless community and the wider population. This research looks at youth homelessness, but hasn't been research done on the homelessness generally, and I think actually that probably needs to happen. Young people who are LGBTQ plus are more likely to leave stable accommodation to escape emotional, mental, physical and sexual abuse, and are at greater risk of harm than their non-LGBTQ plus peers when they become homeless. Yet despite this, they are completely underserved by support services that should be designed to support their specific needs. The Albert Kennedy Trust, in some research they did a few years ago, found that young people who were LGBTQ+, were 4 times more likely to become homeless than their non-LGBTQ+ peers, which is a really horrifying statistic. Yet, in contrast, ONS statistics suggest that just 4.1% of the population identify as LGB, and it's thought that trans people represent less than 1% of the population. From Llamau's own data, we know that 9% of the young people that we supported in our supported accommodation services last year describe themselves as LGBT. And we think this is an underestimate, and this is partly because of when we ask the question. We ask that question when people come into our services. What we're doing now is changing when we ask that question, because people don't feel that they're trusted, they don't feel they're safe. And that's the same with lots of other statistics of information that we collect. So basically, from this research, we know that services working with young people who are homeless, whether within statutory sector, health sectors or third sectors, really have a long way to go to win the trust of these young people. And we anticipate that as we change our services and we work to win that trust, we will see that as young people feel that they're more respected and that their rights are being respected as LGBTQ plus individuals, that we will see an increase in the number of young people who are homeless as LGBTQ plus. We know that, as I've said earlier, that LGBTQ plus young people are at increased risk of harm when they become homeless. Obviously, as we've already heard, homelessness is really, really challenging for everybody who experiences it. But LGBTQ plus young people often have to cope with homophobic and transphobic discrimination and violence, as well as everything else that homelessness entails. As a result, they experience greater risk of psychological harm than their peers, and they're also more likely to develop substance misuse issues, to self-manage and cope with the things that are happening to them. They're also more likely to be exposed to sexual exploitation. The young people that were interviewed told the researchers that they experience far greater difficulty obtaining safe shelter, staying in school, earning money, and accessing social support and health services than their non-LGBTQ plus peers. The young people we spoke to talked about exposure to considerable risk of harm when homeless, and some of these young people turned to survival sex. They noted numerous situations when they were in considerable risk. They were using social media to find a place to stay, which was something that was noted by a number of the participants. And some mentioned the use of Grindr, not just in terms of meeting somebody as a hookup, but also as finding a place to stay. One young person talked explicitly about the protective measures they felt they needed to avoid harm. They talked about using Grindr to hook up, and every time they've gone to meet what they called was a randomer, they had a knife in their boot. This made them more at risk of violence to themselves, but also more at risk of being criminalised if they were stopped and searched. Others talked about other harmful experiences and the impact of sofa surfing that has on their self-esteem. One young person talked about being in numerous homes where they felt and known that they're not wanted, which has really put me out of my comfort zone. We also know that for trans people, domestic abuse is a particular concern, and obviously subsequent relationship breakdown is a key risk. But this is also often compounded by familial rejection. One young person said, "Yeah, I guess that relationship, well, I guess you'd call it coercive control. It took me a long time to realise that. How do you even realise when the only person in the world who is ever there for you is a big part of the problem? They had nobody else to turn to." Poor mental health was also described as a huge problem by almost everybody we spoke to. Young people's experiences of mental health support were, apart from one, almost universally negative, and this is something I think the health professionals in the room really need to take on board. One young person told us that it took them 9 years to get a diagnosis and the support they needed. And I'm just going to repeat that, 9 years. Think about the impact on that young person. And they described a protracted and damaging period of being pushed from pillar to post. As with many young people, the predominant cause of LGBTQ plus youth homelessness is family relationship breakdown, with abuse at home a greater risk for this group. We know that homelessness is most likely to occur when a young person comes out as LGBTQ plus to their family. And a recent Albert Kennedy report found that almost half of LGBTQ plus young people who were homeless came from religious families of any faith. Many of the young people interviewed for this study experienced rejection from families unprepared to accept them for who they are. They told us the fact that they were LGBTQ+ had in some way contributed to their homelessness. One young person said, "I think the majority of my family are homophobic." Another young person said, "My family treated me like it was a mental illness, saying you can get help for this, you can be cured. It was definitely one of the main reasons why I became homeless." For trans young people, family rejection was also characterised by refusal to use their correct name or pronoun. And I meant to say when I started, to introduce myself, saying that my pronouns are she and her. And I'll talk about why that's really important recently. So this refusal by families to use this correct name or pronoun is a practice that is understood to have severe mental health consequences. One young person told the researchers, "They just refused me to call me by my name. They kept calling me she. Well, I'm not she. They kept calling me by my dead name. Well, that's not who I am. Truth be told, I've never been her. It's not like this should have been a surprise. I've been telling them for years." So that's when I left. I packed all my stuff and just left, just like that. I had to get away, but I had nowhere to go. The young people we spoke to highlighted a real lack of early intervention, so you can see the threads coming through all the speakers today, particularly from social services and from CAMS. One said, "I think social services were massively detrimental to my situation. My dad would never have known I was gay if social services hadn't told them." I'll just leave a space at that after that. Poor mental health was a recurrent theme across the board for each young person reporting mental health issues. Yet most of the researchers had struggled to access help, as I've already said. Llamau's own data suggests a significantly higher proportion of mental health issues amongst LGBTQ+ young people that we're working with. For example, in 2017-18, 72% of young homeless LGBT people who were accessing our supported housing services said they were experiencing poor mental health at the start of their support, compared to 64% of their non-LGBT peers. So we believe that a more proactive offer to engage young people in mental health support before situations deteriorated may well have prevented their experience of trauma going forward. One young person said, "I felt quite lost and abandoned. I already had attachment disorder, but I saw it got a lot worse when I felt that I was being abandoned and moved around so much. It made my mental health go downhill." We heard mixed experiences across both statutory and third sector agencies. Some young people really praised the services they had, others decried a real lack of support of any kind. One young person said, "I didn't get much help from my council. They offered me only a sleeping bag and a tent. But I did get a lot of help from their mental health teams," that was a one young person, pushing for me to get a place into a third sector accommodation support provider. Trans young people particularly had the worst experiences of all when accessing services. And we'll hear from Rudy later, who will talk about his experiences. They had issues around gendered provision, or in one case, a young person was effectively asked to see their gender as negotiable in order to access accommodation from a third sector provider. So we did ask the young people that were interviewed what they thought were the solutions to reducing the numbers of LGBTQ plus young people who become homeless. And typically, these were very innovative, creative and broad-ranging solutions. They told us they wanted to see a number of changes as a result of their experiences. They wanted to see major societal shifts in attitudes with more focus on LGBTQ plus rights at school, more focus on addressing breaches of these rights, and more early intervention for those at risk. They talked to us about the importance of LGBTQ plus youth groups in offering them a safe space and an opportunity to develop positive relationships and feel part of a community. And we know obviously that youth services have been decimated across many local authorities, so the importance of keeping these going and funding these is crucial. They told us they wanted to see changes to homelessness services. LGBTQ plus specific homelessness services were called for by a number of those we spoke to, both young people and practitioners, and there's strong evidence in the literature around their effectiveness. So I'm just going to go through some of the recommendations now. Firstly, starting at a strategic level, the report very clearly says that Welsh Government's next homelessness strategy, I'm looking at Emma here, should address LGBTQ plus youth homelessness specifically. We want to see high-level strategic support on this issue, and we want to see government proudly supporting young LGBTQ plus young people on this issue and declaring that the situation in Wales where young people who are LGBTQ plus who are 4 times more likely to become homeless is just not acceptable. We need to see preventative approaches written into the next Welsh Government's homelessness strategies, and as part of this approach we recommend that Welsh Government support the trial of a Geelong upstream Cymru style service where schools work with youth homelessness services to identify young people at risk at homelessness. And it's great to see that I think every speaker has mentioned this so far, so that's positive. Because schools do offer a really good opportunity to prevent youth homelessness or intervene early. And while a generic survey across all young pupils in a secondary school doesn't need to specifically address gender identity or sexuality for those completing the survey, it would enable schools to pick up tensions at home and introduce appropriate support to prevent homelessness. We need to better understand the scale of the problem so that we can ensure appropriate support is put in place. So one of the recommendations is that Welsh Government should request data from local authorities on the numbers of LGBTQ plus people accessing homelessness services, and this data should be presented in a fashion which allows for cross-referencing by age so that the scale of youth homelessness LGBT statistics can be particularly understood. It's crucial that gathering statistics is also done in a really sensitive fashion So monitoring questions should be co-designed with the LGBTQ+ community, and data should only be used for specific and stated purposes. Local authorities too have a strategic role to play. We need to see a strategic approach developed by experts by experience from their local area in conjunction with the local authorities. Local authorities need to revisit their statutory homelessness reviews and 5-year homelessness strategies in light of these findings, consulting with local LGBTQ+ groups and ensuring their strategic commitment. And at this point, I'd really like to big up the Vale of Glamorgan and congratulate them for taking on board all the recommendations in this report and putting it into an action plan. I'm sure I can see a lot of other local authorities here today. I'm sure they're doing exactly the same thing, but I have seen what the Vale of Glamorgan have done, and I'd really like to congratulate them. So we want to see local authorities commission more LGBTQ+ specific support services, such as specific supported housing services. And I'm really pleased that Welsh Government, through the Homelessness Innovation Fund, has funded Llamau Viva, which is an LGBTQ+ youth service in Denbighshire and Denbighshire Council, to co-deliver Wales's first specific LGBTQ+ supported accommodation services. And I'd really recommend that local authority commissioners follow the progress of this service and other LGBTQ+ services in England to learn about them and try and replicate the effectiveness. Local authorities also need to be aware of and linked in to the youth groups in these areas and actually fund these services as well. We also need to make sure that there's training for everybody working with LGBTQ+ services, and this training needs to be done specifically with LGBTQ+ groups. We heard from a lot of people who were misgendered or were asked the wrong questions, and this goes across all services. And I introduced myself halfway through the presentation through my pronouns. One really simple thing to do would be that when we're meeting somebody who's accessing service, if we actually introduce ourselves by our pronoun, that would straight away give people a good idea. Introducing gender-neutral toilets is also a really important thing to do, and making sure that there is privacy for people to talk about their issues. So they're not having to talk about why they've become homeless, in a large room or where other people can hear of them, particularly because when they've actually told their family that they've become homeless, it's caused loads of issues and resulted in their homelessness. So I'm going to leave you with a question, really. It's really important that we take on board the recommendations because it's absolutely shameful that in the 21st century in Wales, LGBTQ+ young people are 4 times more likely to become homeless. But it's equally important that we don't pay lip service to this. You know, at Llamau, we've put small stickers around, rainbow flags, trans flags, to show that we're friendly. We've made gender-neutral toilets across all our services. But if we don't put the right training in place, we can actually re-traumatise people. We could be sending out the wrong messages and re-traumatising young people who think it's a safe space. So I've got 2 questions for you before Rudy kicks me off the stage. How genuinely confident are you that an LGBT young person accessing your services today or tomorrow, whatever service you provide, would have the same positive experience as a straight or cisgendered young person? I ask you to answer that honestly. Do you think they would have the same service? And if you're anyway doubtful that they would, then what are you going to do and take away from this to make sure that your service is LGBTQ+ friendly? And finally, I'm really conscious that I'm standing here as a straight woman talking about LGBTQ+ youth homelessness. But actually, if we're going to end the issue and stand up for LGBT rights, if we're going to end homophobia and transphobia, we all have a part to play in this. So I am standing and attempting to be an ally to this community, and I really hope that you will join me too in doing that. I've got some copies of the report if people are interested, and the copies are also on the Llamau website. Thank you very much.